I am Dr. Nuhu Tanko. I want to speak on non-communicable disease, which NCDs, wholly known as NCDs. I'm just going to look at the definition of the concept of non-communicable diseases. We're going to probably look at the epidemiology of non-communicable disease globally, also the sub-Saharan Africa. And to some extent, we're going to look at it contextually in Nigeria. Then we're going to look at the implications associated with non-communicable diseases. And we're going to look at the leading causes of deaths related to NCDs and their risk factors. By way of introduction, if we look at it, priority was placed on infectious diseases in the past due to menace of communicable diseases, most especially within the sub-Saharan Africa, and epidemiological studies, however, highlighted the ever-growing prevalence of non-communicable diseases in sub-Saharan Africa alongside global data, where the need for attention to non-communicable diseases can never be overemphasized. Why do we have to look at non-communicable diseases? Because the world's most challenging public health issue is now non-communicable disease, and there are staggering and alarming statistics that describe the extent of the problem of non-communicable diseases. If I may just give a statistics, there's about 70 to 80% of deaths in the low and middle income countries, which translates to 41 million deaths per year due to non-communicable diseases. So why are we looking at non-communicable disease as a major public health issue? It's because it is the leading causes of death globally. That is one. And mortality rates associated with this disease are on the earth increase. And about 14 million deaths occurs among persons between the age of 30 and 70 years. And also, there is significant impact on the working population of the developing nations. So, if we may define what non-communicable disease is, according to WHO 2019, NCDs are chronic diseases which refer to conditions resulting from a combination of behavioral factors, environmental factors, genetic factors, and physiological factors, and they tend to have a long duration. So it is chronic in nature, and it is supported by 4 conditions based on the definition of the WHO, which comprises of the behavioral factors, genetic factors, environmental factors, and physiological factors. So if we look at it again in some simple terms, again, NCDs are medical conditions that are not infectious or transferable from person to person, and they're typically chronic and long-lasting, and may be caused by a combination of genetic, environment, and lifestyle factors. So, if you look at it again, in summary, NCDs are the diseases caused by multifactorial causations. They have long latent periods, an indefinite onset, and non-contagious among individuals, and they include both types of diseases, such as the cardiovascular diseases, renal diseases, nervous and mental disorders, musculoskeletal conditions, chronic non-specific respiratory disease, cancer, diabetes, and various other metabolic and degenerative diseases. But the risk factors of NCDs generally include tobacco use, alcohol use, physical inactivity, unhealthy diet, and some unhealthy conditions such as overweight, high systolic blood pressure, high fasting plasma glucose, and high cholesterol level. We're going to stop here. In the next class or in the next video, you're going to see the risk factors, which they are divided into modifiable risk factors and non-modifiable risk factors. I would like to stop here. Thank you.